The Evolution Revision Knee System is built on a 20-year clinically proven heritage of patient satisfaction and survivorship. It is the only revision knee system that maintains the proven kinematic benefits of a medial-pivot design. The insert features PCL and ACL substituting lips, creating spherical conformity on the medial side that promotes ball and socket articulation. Meanwhile, a lateral arcuate path allows for 4 degrees of axial rotation for more normal feeling. The system is designed to offer surgeons intraoperative flexibility to meet all individual anatomic patient needs. The CCK femoral implant features an articulating surface identical to the primary system, a closed box and cam mechanism, and a trunnion that allows for the attachment of stems, adapters, and distal and posterior augments. Both cemented and canal-filling stems are offered in a variety of lengths and diameters. Canal-filling stems contain splines and flutes to promote immediate fixation, and a flexible coronal slot to accommodate long-term endosteal bone changes. The system includes stem extensions to allow for additional fixation, as well as offset adapters that allow for 360 degrees of rotation to facilitate optimal bone coverage. Femoral augments are available in thicknesses of 4, 8, and 12 millimeters for the distal and posterior condyles and are secured to the femoral component with a screw. The revision tibial base implant is asymmetrical for improved bone coverage, features an enhanced locking mechanism, and is available in a variety of sizes. Revision inserts are offered in a variety of thicknesses, allow for one-up, one-down interchangeability, and feature articulating surfaces that conform to the femoral component condyles. Tibial augments match the natural tibial geometry and are offered in 5, 10, and 15 millimeter heights with both medial and lateral options. Lastly, modular keels are available in 2 sizes to optimize rotational stability.